This week on Ryan and Megan, we talk about how clinician burnout is a real thing, y'all.
Welcome to episode number 18. We are Ryan and Megan, two traveling physical therapists. We've been traveling since 2020. Now we have two little kids and we're still doing it. And today we are talking about clinician burnout and how travel may be a way to fight it.
Yeah. I think, just establishing that clinician burnout is real. And I think we've been able to mitigate it quite a bit because of travel. And how we use travel. We want to discuss today on how we use travel to do that. But before we get into it, if you're listening to us on any of your podcast carriers, please consider giving us a 5-star review. That really just helps promote our podcast. We would greatly appreciate it.
Okay, so number one thing that comes to mind is that when you're a traveler, you got a little bit of the power in your back pocket. I think, in my opinion, you've got some negotiating power with the facility because they need you to come and work so that they can keep earning money and seeing patients. That gives you, the opportunity to kind of specify what things are important in your job. So if that comes to like pay or time or not being pushed over to do like notes off the clock and stuff like that, you have some power.
Right. Yeah, I just think that general negotiating power makes you feel empowered, and in some sense, having some control makes you feel less burnout because even if you're at a contract, if it's not going well, or you feel like, ooh, this one's really working me hard, that it's going to end at the end of your contract, and then you can change it up, you can switch.
Yeah, it's kind of psychological.
It really is. You might be doing the same work you were at your permanent job, but that freedom of I have control, I have a choice is probably one of the biggest things that helps that clinician burnout because you can gut out working hard. No one here, most healthcare workers aren't afraid to work hard. It's the fact that you work hard and it's never going to end that really, I think, leads to the burnout.
You've got all of that like power and flexibility. And so even in the back of your mind, you're still working. You might be working longer days, but you just don't have to worry about doing it for years and years and years or having people tell you when it's going to end.
Right. I think as a permanent therapist or permanent nurse or wherever you're at in the healthcare field, signing a contract for like a permanent contract for 1, 2, 3, 5 years really does take a psychological toll on you because, yes, you have security with that. And some people, that's the only thing they care about. But with that security, you're kind of stuck there for a while. And I think that, for me personally, weighs on me the most. And with travel, I know, okay, this place is really pumping patients in and out, but I still feel like I'm helping them. And I know it's going to end in 13 weeks is very different than I still got to be here for the next 2 years doing this every day, all day. And I only get a certain amount of vacation time. So I think clinician burnout just kind of keeps building on itself. And so when you start looking at, I'm stuck here for the next 2 years, they're really working me hard. I don't have anywhere else to go necessarily in my small town. And then on top of that, okay, I get a week or 2 weeks of paid vacation, and I can't take off any other time, even if I took it unpaid. I think it really mounts on people and wears you down. And then that's why we're seeing such high clinician burnout numbers in the healthcare field. They need us, but yet also it's a very thankless job too, in a way.
Yeah, I also think being around the same management for a long amount of time can get challenging because typically companies ask more from you. Always. It's not usually, unless you find a really good company, then maybe you want to stay there. But It's usually small thanks for what you're doing and putting new requirements on you. And we've even felt this during our contracts from companies who are getting surveyed, or they're just, having a lot of changes coming down the pipeline. We will hear about all of the new things every week that they're asking you to do for your documentation usually. And so if you're just around that management and they're constantly changing, constantly asking you to do more things, constantly asking you to update what you're doing, some of that is good to stay updated, but a lot of it can become very draining and make you feel unappreciated.
Mm-hmm.
So I think that would be hard.
I think that's big because there's been some places we've worked where maybe a change has come down from up top, and the change is actually a good one. It makes us more efficient. It's good, but there has been this set way maybe at that clinic. And if you've been there for so long, you kind of set in your ways. And then everything that's came down from top has just been added work on top of you. Then when a good idea comes, like a certain documentation change, or, we're going electronic, you don't even have to worry about that paper anymore. I've seen where clinicians are so burnt out from all the stuff coming down that they reject everything.
Yeah.
And they're not looking at it as like an opportunity to make them do less work, because everything they've been given has been more work, and they've become kind of jaded on it, or they've just kind of are burnt out from being told what to do. And so even when good changes come,
yeah, that's a good point.
They're just so burnt out. They're just like, just no, no, no. And so it is really rare, though, I would say, for when they want you to do something new. A lot of times it's like,
better.
We want you to do this
or less work.
It is going to be more work, but we're not taking anything else away. And over time, that just kind of wears on you.
Mm-hmm. Yeah. So as a traveler, we've even experienced that in short times that we've been at a job. And what's nice is that we know our contract is ending and we can wash our hands of it and we don't have to worry about it anymore. So there is the added aspect of you learn new documentation, you learn a new company, but you can leave the other stuff in the past, which is really nice.
Right. I think going back to kind of that negotiating power, one of those negotiating powers for a contractor is not having to document off the clock. Now, we would encourage any therapists or healthcare workers to don't get sucked into the culture of documenting off the clock. Some clinics will say, well, everyone does it. All these therapists do it. And it really does become kind of a cultural thing of like, well, everyone just sees 15 patients and then documents for 2 hours at home.
Mm-hmm. Sometimes that's hard when you've got salaried employees, but especially when you're paid by the hour. And I would say especially when you're home, like you're not at work. It's not during typical work hours. When you're working more than your 8 hours a day, that's really crossing a line.
Right. So as a traveler, you do have some negotiating power because you're going to be there temporarily. They need you. And you have a little bit of a negotiating buffer with your travel company. So your travel company does not want you documenting off the clock because that is a liability to them. That is considered like you working at home. And they signed a contract with that facility for you to work at their facility. And so it is a liability on them. And so we've had a couple different occasions where they were wanting us to take documentation home and not giving us enough time during the day to do it. They were just kind of pumping it full of patients. And we just said no. We said, no, we're not going to do that. Our travel company doesn't want us to do that. If it's an issue, you can talk to our recruiter or you can talk to our travel company. And that has been always a big help to kind of add that buffer. But sometimes you just have to say no and feel a little awkward. And it's really awkward, I will admit, when your coworker who's been there for 5 years as a permanent staff person is taking home, 2-3 hours of documentation. And you're saying, nope, if I can't document all of it while I'm here, then I need to see less patients or give me an hour of documentation at the end of my day, or just give me time in between.
And not during your lunch.
And not during your lunch. They always like to do that to you too. They're like, well, you have to document on lunch.
There are labor laws, okay?
Right.
And
right.
I think, forgive me if I'm wrong, but even for people who are full-time salaried, there are still laws in place, and it's still a liability for you to be taking work home, especially when it comes to healthcare, because there's a lot of protected health information. And so I don't know if that liability falls on the company that's employing you, or if it falls on you and you have to stand up and say, I'm not taking that liability with my license. But I think this is a huge area, especially for therapists, where when we do take home charting and notes, we're sending a message to the company that says, look at all of this work I can get done in 1 8-hour day. When really that's not an accurate reflection of the work that you're getting. It's more like, look at all this work I'm getting done in a 10, 11-hour day, and you're, booking me
and
for
that
8.
puts the therapists like us who stand up for ourselves a little bit and say, no, we're not going to document off the clock. It makes us look bad because it's like, oh, well, you only saw 10 patients today and Sally saw 15 or 20.
Makes us look like we have low productivity, and beyond us, it makes
it sets an expectation in
with
that
insurance
clinic.
reimbursement,
Mm-hmm.
with employment, and I think hopefully this next generation will stand up a little bit to that, and I think it's just been in the industry for so long, it's just so normal and not questioned,
Mm-hmm.
and I think healthcare workers want to spend quality time with their patients and do the best for them, so they'll put notes off. I know that's what I tend to do. I won't pay attention to my computer during the day when I know I need to, because I'm having an important discussion with a patient. So I think it's all because...
And healthcare workers are generally hard workers, and we give. And so when the company says, hey, can you pick up these 2 other patients at the end of the day? Well, yeah, we want to treat them. We've seen them. They're human beings. And so as healthcare workers, we give. But there is times when we need to say, nope, I can't do that. And so as a traveler, we're in a little bit better position than a permanent staff person. If you're a permanent staff employee and you're salaried and you say no, they can say, okay, well, good luck finding another job in this town. Now, if you live in a city, maybe that's easy. But if you only have 2 hospitals in the town, or, you're really trying to keep that job, you're not going to be moving. But as a traveler, we have tons of options. So we can say, no, we're not going to document off the clock. Respectfully, we would always say, try to be as efficient as possible with your documentation. We pride ourselves in not slacking on that. We try to do as much documentation with the patient while also being engaged with them. So be respectful to your therapy manager, be respectful to the facility, and just say, hey, nope, I'm not going to do that. Here's what I can do. Is there anything I can do with my documentation to make it better? This is what I'm already doing. And if they have an issue, then you can talk to my travel company. They don't want me documenting off the clock. If that doesn't work, the other thing we would say is since you're getting paid hourly, then charge for your time. And so if that means not leaving that outpatient clinic and you stay there for another hour or 2 afterwards and make your 8-hour day to a 9 or 10, then I would do it and I would charge it.
Mm-hmm.
And you'd be surprised how quickly facilities all of a sudden will make time for your documentation.
Yeah.
Because they are already paying you a premium and they do not want to pay the traveler overtime. And so...
Unless they do. There's some places that are okay with that. But
This is all about getting paid, though, what you're worth. And I think as healthcare workers, there's too many times we do not get paid what we're worth, or we don't charge our time for what we're worth. And that leads to us feeling burnt out because we don't feel valued.
Mm-hmm.
So this is a big one. As you can see, we're kind of up on our soapboxes. We'll keep shouting this to the rooftops. But this is probably a big one for us because we can see how it makes other people we work with get really burnt out. And sometimes we just got to say no. And as a traveler, you have a little more negotiating power to do that.
Yeah. And I mean, beyond that, I think a big problem in our industry is that insurance reimbursement keeps dropping and dropping. The price for our degree has increased, and generally salary has not increased. So somehow we have to get that message to insurance to keep their reimbursement rates at least where they are, instead of literally, I think almost every year I see an email come across my desk about Medicare cutting therapy reimbursement rates again.
I think that's a good point just to keep in mind, because usually the facility or your therapy manager or whoever your manager is, they're just doing their job and telling you what's expected. Even the facility, like if it's an outpatient clinic, there's a reason why they're trying to see so many people, is because they're trying to make money. Ultimately, this is how they make money. And with such low reimbursements, they have to see that many people. So just don't look at them as the bad guys. They're just trying to do what they can. But you gotta look out for yourself too a little bit.
Mm-hmm.
One of the other things, and Megan kind of touched on this a little bit, is no matter where you're at, there's going to be some office drama. But as a traveler, after 13 weeks, you can say, okay, see you later, drama. Now, that doesn't mean for you to walk in there and be the drama. We want travelers to make a good name for ourselves, so we get asked back. But when you're at some place for an extended period of time, there's going to be drama, and we get to kind of avoid that.
Yeah. Yeah, that is kind of an aspect. Hopefully you get to come in and usually be the good guy, because they're usually needing some help, and you get to come in and help. And then, and hopefully that's usually your experience. But anywhere there's a lot of people, there's always something going on.
I would say for all of our travel contracts, all of our coworkers and even the office people and the people there, they're actually really excited for you to be there. They've been needing help. They've been short-staffed, and so they are happy for you to be there. They want you to stay. It's been very welcoming. We have not been shaded or been looked poorly upon from anyone just because we're a traveler. I think that's a kind of a fear out there, is that, travelers are just coming in and they'll mess everything up. That has not been our experience. They have been very welcoming. They don't give us all the hard patients. I know that's another myth out there. If anything, they help us out and onboard us because they need our help and they want us to stay. So they don't give us all those hard patients or anything.
Yeah. Okay, so another way to kind of fight the burnout that is nice in travel is that you just earn a little bit more money, which kind of equals flexibility. So you're earning a little bit more. You're also having time off between the contracts, and because you're earning more, you can take time off if you need to just kind of take a little break,
Right. Yeah. It's usually, it's not necessarily all about the money, but money does help. When you make more, you are able to leave a contract if you need to. You're able to feel a little bit more confident if you lose a job because you're standing up for yourself. Not that this has ever happened to us, but the decisions you make are very different when you have money in your pocket and you're not just living paycheck to paycheck. And the best way to not live paycheck to paycheck is to increase your income, which you get with travel. And so that's where that flexibility comes. Again, life isn't all about money, but you do need money to do some things, and travel can kind of answer that part of the equation. I mean, just simply the math of it is, with travel, at least for us as travel physical therapists, we're going to earn 1.5 to 2 times as much as we would for our yearly salary back home. So if we're earning 2 times as much, then that means we could work 6 months and earn what we would working a whole year, 40 hours a week. That gives you a lot of flexibility of where you want to go, what you want to do, how you want to do it, what setting you want to do it in. So money is important.
And then it also kind of frees you up to take these things that we call mini retirements. So
I would say this is like the peak thing. Negotiating power is important, and the control aspect, but mini retirements is what drives me out of clinician burnout.
Yeah. You want to talk about it?
No, go ahead.
No, it's okay. You can jump in. But basically, we're just looking at our life as travelers, um, as it giving us the opportunity to take maybe potentially multiple weeks off at a time in between contracts. We don't have a job that we're beholden to say, hey, we're not going to be here for multiple weeks. I know you need me. Most jobs won't even let you do that because they do need you, even if you've got all the PTO or even if you take it without earning any PTO, they won't let you be gone that long without losing your job. So the fact that you can have multiple weeks after you finish an assignment where you're just going to take some sort of trip that you've wanted to take that you might be close to because of your contract, can be something really huge to look forward to and to kind of break up the monotony of working. And it's a really unique opportunity.
Yeah, don't work your life away. Be smart, save for retirement, but you don't have to work your life away. There's a lot of life to be lived right now while you're young, while you're in your 20s, while you're in your 30s, while you're in your 40s, while you're in your 50s and up. And there's always things that you can go do. And travel therapy is so perfect because at the end of your 13-week assignment, you can decide, okay, I'm going to take, even if it's just like a few days off between your contracts, that is such a great reset on your mind. And you're going into something new. And that just really, I think, cools you down from getting that clinician burnout because, again, you're not on that constant hamster wheel of working. You are in control of your time. And if that means, okay, I'm going to spend a month in the mountains, or I'm going to go national park hopping on this road trip, or I'm going to take an international trip, or if that's just I'm going to spend time at home with my family for a week, then you have the flexibility to do that. And so take mini retirements now with travel therapy. I think another thing, and you mentioned it a little bit, is that hanging over your head feeling as a clinician, as a healthcare provider, of you have patients, you've been seeing them, and then for you to like leave for a month or even like a week. I know I would feel so guilty just to leave for a week vacation when my patients are back here, because you feel like people are really depending on you, and they kind of are. They're depending on your care. And so as healthcare workers, I think we're really empathetic with that. And it's really hard to leave, and your company knows that. And so that's why they, you could have all the PTO built up and they don't want you to put it all together. But you're kind of relieved from that burden as a traveler because you came in, you did your travel contract, you did your 13 weeks, and then you get to put a bookend on it and then go do what you want with nothing hanging over your head, and nothing you have to come back to restart up. Sometimes that's even harder. You go take a week vacation, and when you come back to work, you're like, oh my gosh, was it worth me taking a week off? Because now I have all this to do.
I think it also, being a traveler also opens your mind up to being willing to dream about things that you want to do, because you know that it's potentially possible, because you've got, time in between your contracts where if you want to make it happen, you could. And I think that is also something that might be a little bit rare when you're in a position and you're fully employed as a permanent staff, because you don't know if you're ever going to have like a big chunk of time to make something like that possible. So you don't even let it be a thought, because it's not feasible. So I think even just the aspect of opening up your mind to think about, what do I want to go do? What do I want to see? Because I can potentially make that work. And that's a real blessing.
Yeah, that's a huge perk of travel. The next one, something that travel therapy does really well to help avoid clinician burnout, is you can try different work settings. And so for therapy, which we're most familiar with, we can work home health. And then if we feel kind of bored with that monotony, we could go work a skilled nursing facility, or we can go to outpatient and jog our outpatient brains, and or you can go work in the hospital. So you can change settings however you feel most comfortable, and just not have so much pressure. If you are a permanent person working in one setting and you go look to change another, you're looking at signing like a 1-year, 2-year contract. And that's actually kind of a big commitment for a setting maybe you haven't worked in a while or have never worked in. But with travel, you can try that new setting and see how you like it because it's only 13 weeks and you're going to learn a lot from it.
Right. And kind of along with that, as a traveler, changing settings and interacting with other therapists, you're going to learn new skills from that. And then you also may be treating different patient populations. So it's just a lot of change, which for some people is intimidating. And it doesn't have to be.
You don't have to do that as a traveler.
You don't have to always consistently change settings and stuff like that. But it's an opportunity. And if you kind of like to mix things up or like to learn new things, you are going to come across that easily if you choose to pursue that.
It's another good way that you can use travel therapy to avoid that burnout.
So I think.
Do you have any other ones that come to the top of your mind on how travel therapy has kind of helped us at least avoid clinician burnout?
No, I just think if you've been listening to this and you've been like, man, all of that sounds really, really nice. I need to get out of this place that I'm stuck in. I am so burnt out. I'm tired. I just need a little bit of change. I just need to try it. It's easy to try, and you can try it for 13 weeks. That's one contract. And if you really hate it, you can just go back to a permanent job. Might not be the same one you came from. Maybe you need that change anyway, but there's always permanent jobs open in the healthcare field. They're pretty abundant. That's what I was looking for. So if you've been thinking that while you have been listening to this episode, please reach out to us. We can give you some good recruiter recommendations to get you started with travel, to really hook you up with a good job, make your whole experience nice. So I think we have a form linked in the description that you can fill out, or you can email us at ryanandmeganorear@gmail.com.
Ultimately, travel allows you to be in control of your future. And I think that's one of the biggest perks that we have gotten from travel. But moving on to our What's Been Good, What's Been Poopy segment. Megan, what has been poopy?
My daughter stepped in dog poop the other day.
Stepping in dog poop really is the worst.
It truly is poopy.
Why is it so smelly, and why is it so hard to get off shoes?
I don't know. I haven't even tried to get it off. It just...
Ew.
Yeah.
I thought you cleaned it.
No, I didn't. I set it aside because I was like, that's disgusting. So they did not track through the house. But then it hardened on there. And I was like, I'm not going to soak this shoe to get the poop soft again.
She likes those Crocs. You better
then we
wash
had to go, and I forgot that there was poop on the bottom of it. So I just put them back on, and then I was like, oh crap, there's poop on this shoe. But then she played, and like it's all rubbed off. So
perfect nature.
That's my good thing, is I didn't have to clean poop off her shoe. I just let her walk it off.
That is a good thing.
Yeah. All right. What's been poopy, Ryan?
I do not have another poopy thing.
Wow.
So,
your life must be like perfect.
It's been pretty good. The girls are doing good. They're sleeping better. So no poopy.
What's been good?
What's been good is us looking at these RV tours of these Brinkley, I believe is the brand, Brinkley RVs. They are amazing. The price tag is very steep, but they're like the company that finally answered all the questions RVers have. So there was a long trend where all RVs were really dark. There was all these swirls. Like, why is everything so dark in a small space? So let's make the interior design look like a modern house. Also, let's make the quality of the cabinets like true quality cabinets. Where can we put a trash can? Where can you do your laundry? Where do we put our spices? There's like certain things that needed to be answered. And Brinkley was like, oh, we can do that. Here's an RV. And so they're really pretty. They're awesome to look at. So if you go on YouTube, I'm sure there's plenty of tours you can look at with the Brinkley RV.
It's pretty amazing.
They're pretty amazing.
Yeah.
Alrighty, well, hopefully you enjoyed this video. Hopefully you got something out of it. If you could, if you're watching on YouTube, go ahead and hit that like button. Consider subscribing to our channel. And again, if you are listening on the podcast, consider leaving a 5-star review. And until next time, see ya.